Dr. Marshall Green here at theaestheticface.com. Glad you're checking out our video here today on facelift vectors. So what are we talking about? Okay, so I cannot tell you the number of cosmetic consults I get for facelift where the patient comes in and says, but doc, I don't want to look like this. I saw so-and-so on TV, they got a facelift and they look like this and everyone can tell. So I spend literally probably half my consultation time with facelift telling patients what bad facelifts are, okay? Bad facelifts are facelifts in which the vector is not well controlled. What is the vector? Vector is the direction something is, force is exerted, okay? So when we tighten up a facelift, it has to be done in the right vector. The facelift patient should look refreshed, and in the case of the neck, should have that redefined neck jawline. You should never get the question of, what wind tunnel did you step out of? It should be more of a, did you go to the spa for 3 months? You look great. So when patients have not had the vector well controlled and the surgeon pulls the patient in the wrong direction, you can see patients that come in looking like this. Facelifts are never a lift in which you're supposed to pull the patient upward. It looks very unnatural, okay? So a lot of times what I'll do to simulate what a facelift result will look like for a patient is to lay them in a chair. Lay them flat down, because what we're doing is kind of defying gravity. When we lay you down, that's what that does. So a lot of times what we'll do with the facelift is we tighten the neck and jawline up and put a little bit of pull into the midface, liposuction around the jawline, and redefining the jowls and pulling everything back. You get a little bit of lift in the nasolabial fold region, but if we're really trying to pull you like this, we're not doing you justice, because you're going to look lifted and you will not like it. The place where that does come into it, something else comes into the point of discussion here, is when we're trying to accomplish something with a facelift that really should be accomplished with something else. And this will tie into another discussion somewhere else on the website I have at The Aesthetic Face, and that's more of augmentation of volume. Okay, so if you think about a raisin has lost all of its volume and it's got this wrinkly skin over it. You take a raisin and you pull the skin back, what are you going to have? You're going to have a tight raisin. It's not going to look like a grape again. So what we have to do with a lot of patients is we have to add volume back and not just pull some skin and tighten things up. There's got to be a combination. So a lot of times our patients will benefit from cheek augmentation with either cheek implants or fat transfer, and occasionally facial fillers, or even sometimes chin augmentation to elongate the jawline and add fullness and length back to the jaw and tighten up those tissues that are sagged over time. Also, some of our patients, we go in and put in temple implants to add fullness back in the upper face. But more commonly, we're looking at mid-face deficiencies, cheek implants, fat transfer, filler, volume augmentation combined with your facelift surgery. So we're not just pulling you tight, we're filling your face up, making you look youthful, vibrant again, as well as getting rid of the loose, lax tissue that you don't like when you're coming in for consultation. So, to kind of wrap this up today, remember, okay, we're talking about pulling the patient in the right direction. No one wants to look lifted or too tight. You didn't get out of the wind tunnel. Should be, man, you look so refreshed. That's what we do, why we do everyday cosmetic surgery, helping our patients get that refreshed, rejuvenated look by re-augmenting the volume, getting rid of that extra loose skin and tissue. Once again, I thank you for checking us out. Come on to the website, theaestheticface.com. Dr. Marshall Green, thanks so much.